Hey, everybody, welcome to today's show. Welcome to Advocate Information Highway. I'm your host, Anthony Lorito-Duke, and we have a very interesting topic for today's show in which it is healthcare providers and insurance workers not doing their jobs properly. Let's get right into this. This is nothing of a new situation. This has been going on for decades and whatever, and the only difference is it's been getting worse as time has gone by. And I'll give you a brief example of what I've been going through. Um, on Monday, March 27th, I emailed one of my medical providers discussing about my high blood pressure, and I emailed my medical provider, and I showed him the uh, the pictures from my uh, blood pressure machine, my numbers and stuff, to show that there's an issue. Um, and I emailed him, and for so many days I did not hear back from him. No reply back from to my emails from him. No callback. He never called me. No nothing for days. So then, and I've been tracking him down, trying to find out what's going on and whatever. Yesterday, I called his office again, and the receptionist told me that a prescription was sent to my pharmacy. I said, okay. So I called up my pharmacy, and they said, yes, there's new medicine there waiting for me and stuff from my medical provider. So I said, okay. I go to the pharmacy, I get my medicine, and the pharmacist told me that the medicine was there waiting for me for 3 days. And I says, nobody told me. Nobody said anything to me. Not from the pharmacy, not from my medical provider's office. Nobody. Nobody said anything to me. I could have had the medicine in my system for like 3 days prior. Something really bad could have happened to me. Nobody did their jobs, nothing, right? So then I come back home. I call my medical provider back up again, and I said I got my medicine. I said, but nobody called me from his office. Nobody replied back to my emails. Nothing. I says I could have had this medicine 3 days ago, and it would have been in my system. But you guys did nothing. You told me nothing. No reply back to my emails, no phone calls, nothing. And then I get the, I'm sorry, this, that. But they wanted, but when they're setting up the bill, boy, they got to come fast. They want the money fast. And let's not forget, the payroll department was picture perfect. They know when they get the paychecks. No problems with that department, huh? You know. Now, um, now aside from that issue, I I called up uh, my my health insurance, and I spoke to a representative at their care management department. I stipulated all the medical conditions that I'm going through, and I was inquiring about if I can get in-home visits and stuff. And she put me on hold, and she connected us both to the department that handles the in-home visits and stuff. And it was a three-way telephone conversation. And the representative in uh, from the in-home services department stipulated that there was nothing about me or my information in their systems from my health insurance, in which my health insurance representative found out very weird because they're basically all one system. They're all one system. So um, the representative from my health insurance care management department said she was going to take care of the situation, and I should have received a phone call within a few days from the representative uh, from their at-home services department. I said, now that was Monday, March 27th. Today is Friday, March 31st. Still to this day, no call from anybody. Never received a call from anybody, not from the representative from the in-home services department, nobody from my health insurance's care management team, nobody. Seriously. This is disgusting. This is not a right way of running things, of doing things. You know, we have to go back to the days of if you don't do your job, you don't have a job. That's been gone for way too long. For way too long. So, I mean, seriously, honestly, enough is enough. You know, if this was a situation of any of their loved ones, from their families and stuff, they would have been all over it like that fast, and it would have been done. But if it's anybody else, no, slow as molasses. Oh, we got all these problems. Oh, you got to forgive us. I was sorry. All these excuses and everything. You got to stop all the excuses. No more excuses. Do your jobs or you don't have a job. That's what we need to go back to, ladies and gentlemen. That's desperately needs to come back. They're too soft on many people. Too soft. They're not strict enough. Not strict enough. So, but I just filed my complaint with my health insurance about the situation, and I'm going to even escalate it, and I'm going to send that same complaint over to CMS, which is the government agency that oversees all health insurances and stuff like that. Because when a health insurance gets into trouble with that government agency, all the workers walk on broken glass and rusted nails and stuff. They're like, oh my God, I actually have to do my job. Oh my God, oh my God. Yeah, you have to do your job. That's what you get paid to do. Yes. If you do your job, you don't have to worry about getting into trouble. If you don't do your job, then you got to worry about getting into trouble. It's plain and simple. It's not rocket science. So, but anyways, just got to wait and see what happens and stuff. So, but anyways, I wanted to remind all my fans out there about the business that my husband and I have together called AWLDNY. The link to there is awldny.com. You guys could check out all the items on there. I also wanted to remind all my fans out there about my other business, my other website that I have called Advocate Information Highway. And the link to there is AIHNY.com. Again, that is AIHNY.com. You guys could check out all the pages on there. And so with that, take care, everybody. Bye.